Guys, just like you, my life has been altered by this coronavirus. The official name of it is SARS-CoV-2, and the disease it causes is called COVID-19. I wasn't quite sure 2 weeks ago how serious a threat this is, and up until just a few days ago, I didn't realize the gravity of the consequences. The reality of what is about to happen hit me like a ton of bricks when last week a German mathematician by the name of Daniel Regenberg contacted me to share his mathematical data and how many people are likely to get infected and ultimately how many lives may be lost. I read his entire paper, which I translated from German thanks to Google, and I was completely stunned by the data he showed me. In fact, I was very skeptical about it and I did not believe it. But when I checked his numbers against publicly available data and checked his math, I could not find any flaws. So I felt it was very important to share this data, and I asked him whether I could share it on my YouTube channel, and he agreed. He's also made a series of YouTube videos with a lot more detail, and the link to those is in the description below. Honestly, I'm hoping that one of you can find a flaw in the data, because what we're about to face, not only in the United States, but around the world, is just stunning. I don't like alarmist takes on issues, but given the severity of the situation, I'd rather share the data with you so that you can decide for yourself whether you want to believe it. I'm hoping it's not as bad as the mathematics indicate, and in that case, you guys can make fun of me when this is all over. I'm willing to be ridiculed, if I can help save even one person from getting sick. And I want to emphasize that in this video, I'm looking at the virus from a largely mathematical point of view, not biological. So here's what Daniel shared with me. First, I want you to understand that unless you live in Antarctica, this virus is going to affect you. It will hit you or someone that you know, and it will hit hard. It may already be there and you just don't know it. Second, the official numbers of cases that you're seeing and the numbers of fatalities is misleading. There's a huge lag in these numbers. Third, in the United States, a few weeks from now, our healthcare system here is likely to be overwhelmed and could potentially collapse. We in the United States appear to be on an Italy-like trajectory. In Italy right now, medical professionals are deciding life and death decisions on who gets care and who gets saved by a respirator. 21,000 people have died in the world as of March 25th, and this is probably the tip of the iceberg. The good news is that in some places like South Korea, Taiwan, Singapore, and parts of China, unprecedented control measures seem to be working, so the spread of the virus happens to be slowed and hopefully even stopped. There is a sequence of events that occurs, and there's a certain lag at each step. The sequence goes something like this. People get infected, days later they get sick. Days later, they may get tested if their symptoms require it as judged by their doctor. Days later, they may need to be hospitalized, and days later, they may die. So even if we were to completely stop the spread right now, many more people would still be getting sick from having been infected previously. An interesting thing is that you would expect that this virus might grow at different rates in different countries because of various reasons like climate, the demographics, social interactions. But surprisingly, the numbers are quite consistent for just about every society, every country. The growth rate of infections is anywhere from 25% to 30% per day everywhere you look. Let's just use an average of 27% in the middle. This means that every 3 days, the number of people getting infected with the virus doubles. And that's just simple math according to this equation. So in the United States, the number of infected people as of March 25th is about 62,000. In 10 days, it's going to be about 10 times that number, or about 675,000. And in another 10 days, it'll be 10 times that number, or 7.3 million. And in 10 days, it'll be 80 million after that. So in 1 month, the number increases about 1,300 times. Again, this is unmitigated growth if nothing is done. Now, thankfully, in the United States, I think most people do seem to be taking social distancing seriously. So perhaps the actual numbers of infections will be less. But here's the important point to remember. A University of Massachusetts Amherst study shows that the median incubation period for the virus is about 5 days. And about 98% of people with symptoms show it within 12 days. So there are people carrying the virus right now that do not show any symptoms. So the actual numbers of infected people are likely to be much higher than the 62,000 that we see today. So if we take the latest numbers of infected people from the Johns Hopkins University dashboard, which is 62,000, as of March 25th, this means that the real number of infected people is about 250,000, which we will likely see in about a week from now. The math also tells us that every week the virus will infect about 5 times as many people. So in a month, the virus will be more than 1,000 times the current number. Again, that's math. This is sobering. If we don't make some sacrifices in terms of doing our part to stay socially isolated, the number of infected people in the United States could soar. Now, is there any good news? How can this virus be contained? Now, here's some ways we can contain it and stop perhaps a huge number of our people from getting sick. Lock down the population with social distancing and mandatory shelter in place. Many parts of the country are already doing this, and with this we can keep our system from being overrun. It should be a national order. Massive testing and isolation of people. If we don't test people, we don't know that they're sick, and we have to know that they're sick in order to isolate them. Herd immunity. Now this is interesting. If enough people get sick, then the virus has nowhere else to go. But of course, this is a worst case scenario because it means that just about everyone that could get infected got infected. And this, according to experts, is about 70% of the population, which would be 228 million people in the United States. There could be a vaccine or medicine that treats this virus, but indications are that this is at least 1 year away. Vaccines just aren't made that quickly. Warmer weather may slow down the virus. There is some data that shows that coronaviruses tend to not be as virulent in the summer months, but Australia, which is on the tail end of summer, does not seem to be bucking any of the world trends. So I think that this hope is kind of questionable. Now, Daniel believes, and I don't see a reason to disagree with him on this, if we don't all take action now on a personal, community, and national level, within a month or two, the number of people infected worldwide may be counted in billions and not millions. When will we know that the numbers have peaked? There is something called an inflection point in this exponential curve. We need to look at the numbers of new cases every day, then the ratio between the numbers of new cases today versus yesterday. So if this ratio starts to come down over the course of several days, we'll be closer to the inflection point. And when it gets to 1 over successive days, then we'll be on our way to leveling off. But even after we level off, we have to remain isolated because you have to remember the lag time of 5 to 12 days. There will likely be a significant number of people who have the virus but are not showing any symptoms and could be very infectious. Now let's look at some scenarios. The best case scenario is that we put in strict controls for social isolation, test and identify those that are infected, and take strict quarantine measures, not only for the person infected, but also anyone that may have come into contact with that person for at least the past 11 days. Now, if we do this, the virus will be contained. And this can be done and is being demonstrated in countries like Taiwan, Singapore, South Korea, and China. The virus could also mutate and die out. This happened with SARS and MERS. And of course, we could develop a vaccine. But even if we fast-tracked it, we're looking at 6 to 8 months if we're really lucky, and we don't have 6 to 8 months. The worst case is not easy to talk about. We have to talk about it and be aware of what could happen. If we do not contain this virus and remain on the trajectory that we are currently on, if people do not take social distancing seriously or start going back to work too soon, the virus could spread uncontrollably until it infects as many people as possible, until we reach crowd immunity. This would mean that about 70% of the population gets infected. This is not an exaggeration. International experts from both the United States and abroad agree on this number. This amounts to 228 million people out of a total population of 327 million, just in the United States. How many fatalities would this mean? Well, the official fatality rate from the World Health Organization is 3.4%, but it appears to be 1% in developed countries with typical demographics and good healthcare system, but more like 4% where the system is overwhelmed. This means on the low end, at a 1% fatality rate, the number of deaths would be about 2.3 million. And if our healthcare system gets overwhelmed, we're looking at 9 million fatalities. But long before that happens, the US healthcare system would be overwhelmed. Even though the United States has more hospital beds per capita than most other countries, a total of about 1 million, out of those, only about 100,000 of them are ICU or intensive care beds. And as many as 1 million people may need ICU care at the same time. And an even larger number of people may need ventilators. In 2010, the total number of ventilators available in the United States was only about 62,000. We need ventilators fast, within 2 weeks, or hospitals will have no choice but to start deciding who gets a ventilator and who does not. This could mean that hospitals decide who lives and who doesn't. US is far behind currently in testing and has done only a fraction of the tests per capita as Canada and most other European countries. We appear to be on a path similar to Italy right now, so it's not looking good. And there's talk by some government officials that people should start going back to work to save the economy. This would be a calamity. We need to work together because we are in this together. Let's take care of ourselves and let's take care of each other.